Ready? Hi everyone, I'm Melissa. I'm one of the PAs here at Z Urology, and today we're going to be doing a Testopel insertion. So as I go along, I'm just going to explain what I do. So we have patient X here, and we're just going to get going, okay? So we start off by just prepping the patient, and there's an area here in like the gluteus area. You want to make sure that you're not in the actual fatty part of the gluteus, but more in the muscular part, where we'll be going between the muscle and the fat. So I'll start kind of by demarcating where I'm gonna do my injection, just so I remember. And we're using either 10 cc's of 1% lidocaine or about 5 cc's of 2%. You're gonna feel a pinch, okay? And I start off by just making a wheel, and then I fan it out. Just give it a minute to make sure he's nice and numb. Do you feel that? Do you feel that?
A little bit.
Okay. How about now?
Still a little, but that's okay.
Oh, want to make sure you're comfortable. Feel that now?
That's okay.
Okay. Just gonna give it a few more seconds to work its way in. Once he's good and numb, we'll just make a stab incision with an 11 blade scalpel. And that's where we're gonna get our little trocar in. Do you feel that?
Yeah.
Okay. So just a nice, quick stab incision. And then we use our trocar with the guide to make a little burrow where the pellets will go in. And you want to get it through and between the muscle and the fat. So you go in at a right angle, and then when you get about a centimeter in, you're going to turn into about a 30-degree angle. How are you doing?
Okay. You're the best.
Thank you. You just push in, and I use my other hand to just give myself a little bit of control so I don't push it in too hard or too fast. When you get it in, about this ways in, you pull this guide out, and then we'll put in the pellets. And I like to put in, we're putting in 10 today, so I like to put in 5 first in one direction, and then insert it, and then fan it in another direction. So we'll do 1, just put in the pellets in this little burrow here, 2, 3, 4, and 5. Then there's a little thing to just push it in. And again, you push it in, all the way in one direction, like that. Take it out again, and we'll put the other 5. And fanning it out just allows it to not, for the pellets not to come out and be pushed out. So they're, instead of in one long line of 10 pellets, they're like 2 rows of 5 pellets next to each other. And that just minimizes like rejection of the pellet. So as you can see, I'm just gonna change my trocar in a different direction and push it in again. And while it's in, I hold with the other hand and pull out. And now you have a nice little, just a little hole here, but I just put some pressure for bleeding. And then I'll clean him up and put some steri strips on it. And essentially I tell them and then I dress it with some gauze and tape. And essentially for 24 hours, I just recommend that they don't sit in a pool, a bathtub, not to bathe for 24 hours, and then they can go ahead and take the dressing off. And it just closes from secondary intention. The pellets last about anywhere from 3 to 6 months, depending. And in about a month, he'll come back and get some blood work to see where his testosterone levels are. And then we'll just kind of go from there. So he can also go home with a little dose of antibiotic, just to prevent any skin infections, like for a day or two. And that's pretty much it. Thanks.